By far the most common lower back injury is going to be a disc injury, usually involving the bottom two discs in your spine at L4, 5 and 5S1. These account for 40% of all back injuries, and they can be varying in their severity. So some people might just have discomfort locally in their low back. Some people might have pain that then spreads across their low back and into their legs if it's more severe, and to the point that discs can cause pressure on nerves that start to irritate the nerves that run right down your legs into your feet, that cause weakness, numbness, and almost paralyze the leg at their worst. So disc injuries, they have a grade of things, and this is where the chiropractor needs to understand how long it's been there for, how severe it is, run through some tests to determine that, so that they can determine, okay, is this something that chiropractors can work with? Because the majority of disc injuries chiropractors can work with, but if it gets to that end stage where a disc is maybe compressing a nerve completely, then we need to look towards our surgical colleagues for some more, invasive type treatment to take the pressure off that nerve so that that nerve can live and not die. From there, the next most common injury in the low back is going to involve a facet joint. Now, facets are similar to like an ankle joint. They've got ligaments around it and fluid inside it, and if the joint moves too far, then you can sprain this joint, similar to if you rolled your ankle. So these account for about 30% of all back complaints. Once again, we can treat most of these issues, but the question with these is how did it happen, what caused it, how long has it been for, and that really determines how we look after it, what treatment types are going to be most effective, and then how do we rehabilitate it to get it back to normal for the long term so it doesn't just happen again. And then the third most common type of injury to the low back is an injury to the sacroiliac joint. And this is actually more a joint of the pelvis than the low back, but it does feel like it's in the lower back because it's down in that area. This joint is a much more robust and strong joint. It distributes weight between our skeleton and then our legs. And when this joint starts to play up, people can have pain locally. It can refer down in the back of their thigh. It almost mimics sciatica in some cases. It can be painful walking and moving and a very uncomfortable issue. Chiropractors have a variety of different treatments that help this sort of dysfunction. But as with all these injuries, we want to determine why it's got to that point so that we can then get on top of it in the short term and then stop it coming back for the long term as well. So with all these issues, the main thing that we want to make sure is that we're getting the correct diagnosis, because these different types of injury require different types of treatment. Not everything's a nail that needs a hammer, and we need to determine what is going to be best for you in this situation so that we can get it not only better faster, do it in a safe manner that's not going to make it worse, and then get you back to what you like doing as quick as possible. Now, once that's the case, the next step is to rehabilitate it, give you strengthening, stretching, things like that that's going to help you maintain that improvement for the long term so that you don't have it come back again. Because one of the number one things that happens with back problems is they recur. And depending on what study you read, between 40 and 80% of people that have had low back pain at one point in time, they're going to have it again, and a percentage of those will have it over and over again. So it's really crucial that you manage these things appropriately, get it under control as quick as possible, and then prevent it from coming back again.